Welcome to the Great Girlfriends podcast, where we discuss life, love, laughter, and everything in between. I'm your host, Sybil Amuti, and I can't wait for you to hear all of the Great Girlfriend magic on today's show. So without further ado, grab something great to drink, grab your pen and your paper, and get ready for this week's episode. Enjoy! Hey, great girlfriends. I hope you're having a marvelous day wherever you are. I am as well. And I'm so excited because today I have a newbie to the podcast. This is actually her first podcast, and this is actually her first time with me in conversation. So I want to just first thank Healthy Women for bringing us together to talk about some of the topics that we've been covering in our Silent Killers series. But this specific conversation, I am so excited because Dr. Patricia Ajayi-Fox is doing wonderful work. And I cannot wait to introduce you to her and the work that she's doing in our community. So welcome to the show, Dr. Patricia Ajayi-Fox.
Thank you. Thank you so much for having me, Sybil.
Oh, it's my pleasure. And to know that this is your first podcast makes me so excited. I'll be very gentle. I will be very gentle. So I would love to know just a few things to get to know you personally. What did you have for lunch today?
What did I have for lunch today? It was a breakfast sandwich, actually, from Starbucks.
Oh, okay. I like those sandwiches. That's a good one. Okay.
Yeah,
What did you drink with your breakfast sandwich?
a matcha latte.
Matcha girl. Okay. And then what was the last text message that you sent out today?
It was to my husband.
Okay. And we'll leave that there. Oh my goodness. Okay, so do you prefer sunrise or sunset?
That's a good question. Probably sunrise.
Okay, so are you an early morning person or are you a late night lady?
So I have kids, so I think I'm probably more of late night, but right now, early morning. But I still like
Okay.
the sunrise.
Okay, do you prefer mountains or do you prefer the beach?
Probably not.
Mountains. Wow,
Yeah.
that's exciting. Your favorite country in the world?
I'm from Nigeria. So.
Nigeria. I love it. I love it. I love it. That is so awesome. So tell us what brought you to the US, first of all, and then tell us about who you are and the work that you're doing to really address issues, disparities specifically in Black and Brown communities around colorectal cancer.
Yeah, so I guess I'm originally from Nigeria. I came to the US when I was 17 for undergraduate, like pre-med degree, and then went through the long run for medical school and residency. And so I'm actually a general gastroenterologist. So that means I do colonoscopies and endoscopies, which kind of relates to colon cancer and colorectal cancer screening, because one of the methods of colon cancer screening is a colonoscopy. And so one of my passions is to make sure that everyone has an equal opportunity to get screened, because colon cancer is one of the few cancers that are preventable, which means that you can stop it if you catch it at an early stage.
Mm. Okay, so let's talk a little bit about that. So most people listening are going to go, yes, I have a colon. I know that much, but how how does one develop colorectal cancer, and why is it affecting Black and Brown communities at a higher rate than other communities?
Yeah, so unfortunately, cancer is basically a group of cells that are growing abnormally. And so people can just get colon cancer because, unfortunately, as we get older, we are at higher risk for all different types of abnormal cells, colon cancer being one of them. And the reason that me as a gastroenterologist can help is we can catch these cells, which we call them polyps, because you basically look in the colon and you see the growth. We can catch them at an early stage before they develop into the evil cancer or the killer, where we can't take them out. Unfortunately, they affect everyone, but they affect the Black and Brown communities even more, because due to a multitude of factors that I'm sure we're going to talk about, the Black and Brown communities unfortunately develop these cancers at early ages. And then unfortunately, they don't necessarily present for screening. And so the cancers or polyps are discovered at what they call later stages, which are all higher risk for death, unfortunately.
Mm. Okay, so what are the influencing factors for this specific cancer? Is it diet? I heard you mention age, but is there anything else that influences the rate or the impact of the disease on us?
Yeah. So far as the rate go, we always talk about what can be changed or modifiable factors, and then what cannot be changed, non-modifiable. So some of the ones that cannot be changed are the non-modifiable factors. So age is one thing that affects everyone. Genetics, people are researching this, but there are certain genes that make it more likely for you to get colon cancer. So those are one of the non-modifiable. So no matter what you do, you can't change it. The
Okay.
things that can be changed are things like smoking, alcohol use, obesity, things like that can be changed. And then the things that can be changed that are more social is you've seen people who have insurance and access to healthcare are more likely to be screened. And if you're screened, you're less likely to develop it. So basically, if you don't have insurance, that's it's a modifiable because in theory you can get insurance, but then if you don't have it, you're less likely to get screened and then more likely to get the cancer because we don't catch you early enough.
Mm. So, how early should one be screened for colorectal cancer?
So that's a great question. So previously, we recommended that everyone who didn't have what's called a family history, which I can talk about in a little bit, get screened at age 50. However, 2 years ago, because they noticed that colon cancer was being seen in younger people, they actually recommended, and this is a lot of GI societies and cancer societies that came together, they recommended that everyone starts getting screened at age 45. So now age 45 is the age that we recommend for colon cancer screening.
Okay. And is this something that happens at your standard wellness appointment that it's recommended that you get a referral out, or do you have to ask for this?
So what should be happening is at your primary care appointment, and this is assuming that everyone is going to their primary care appointment, what should be happening is they should be telling you that you're up to date. I tell people they shouldn't mess with their lives. And so even if your primary care doctor doesn't offer it to you, you have the right as a patient and as a person to say, hey, I'm age 45. Can I get screened for colon cancer?
Okay. Okay. So I want to get to this because, okay, modifiable factors. Um, does the data show that it's the modifiable factors that are influencing the rate of disparity, excuse me, between Black and Brown communities and white women and men, or is it the non-modifiable? Is this just something that is genetically attached to us, or is it because of screenings?
So the data, so there's a nice little graph that I wish I could show you that shows that up until the early 2000s, there was a huge disparity in what we call the incidence, so the diagnosing of new cancers, and then mortality, so people dying from it. In the early 2000s, then it started coming down. And so between Black and Brown people versus their white counterparts, the gap started reducing. And what changed in that time is that they started trying to encourage more colonoscopies and trying to address these modifiable factors. So to get back to your point, I do think some non-modifiable factors definitely influence it, but it has been shown by data that going after these modifiable factors, and especially like stuff like healthcare access, insurance access, education, asking patients to advocate for themselves, making sure that they're actually screened, and primary care doctors are telling patients they should be screened, things like that actually help to reduce the new incidence of cancers because they're detected early, they don't get to that point, and also reduces mortality or death because, again, they don't get to the point.
That's it. That's so good to know. So,
Mm-hmm.
okay, in terms of what we see, or symptoms to look out for. And I see all of these ads on social. Great girlfriends here watching and listening. I know you see the ads too about having a leaky gut, cleaning your colon, and how to like really like detoxify some of your organs, with certain drinks and systems and things like that. But I hear that the colonoscopy is the best way to really, I don't want to say clean your colon, but address or you would know the language here, but the way to um assess, I don't know, what are you doing when you do a colonoscopy? That's what I should be asking. But I hear that that's the best approach to, this is all rumor, mind you. But it to managing colon health. That's what I want to
Yes.
say.
Yeah,
Yeah.
so your first question is what do we do in a colonoscopy?
Yeah.
So I guess the short form is as the patient, what you do is the day before you drink that prep, which is usually not the best part of it because it's a laxative. So it helps you poop a lot. The reason that that's important is when I go in with my scope, so basically you come, you're nicely sedated, I put a scope up your bottom because that's where the colon is, and I take a good look within the colon. I know it sounds gross, but it's my job, and I think it's cool. So you take a good look all the way within the colon, and we're looking for those polyps, and it's nice and pink, and we know what polyps look like. So that's basically what a colonoscopy is. The first question about colon cleansing and whatnot, that does not directly affect the rate of colon cancer. What does is getting a good enough clean out that I can have a good look and detect those polyps that could be precursors to cancer.
So the colonoscopy is a form of screening or like detection. Okay.
So it's a
So
screening and for prevention.
got it. So it doesn't necessarily clean the colon.
So what cleans the colon is if you take laxatives, so that cleans out the colon, but it doesn't necessarily cleanse your system, which I don't even fully know what that means, but it doesn't really detoxify you. It just helps you clean out all the stool from your colon so I can have a good look at it.
Got it. Okay. And so is that part of the I mean, if it's part of our screening and our treatment methodology, you're saying at 45, what are the earliest rates of death? Like how, I mean, earliest ages of death that you're seeing with colorectal cancer?
I mean, I guess I'm gonna go more into like I guess social media or public eye. I don't know if you heard about Chadwick Boseman, but he was the actor who was in Black Panther, and he unfortunately passed away at age 43, which is even less than age 45. So that's like a case of really early colon cancer. And I mean,
Yeah.
I've seen patients who've come to me for like follow-up colonoscopies who've had colon cancer in their 30s. It's definitely not as common, but we're seeing that the rate of early onset cancer is increasing.
Okay. So for those that are, in advance of the screening age, what is it that's driving them to even have these tests done? What are they feeling in their bodies? What are some symptoms that they're possibly experiencing?
Yeah, so for symptoms of colon cancer, for one thing that's scary about it is one symptom could be nothing. You could be what we call asymptomatic, and then you don't present or have any symptoms until it's already end stage, which we don't want. Things that I tell people to watch out for is if you have blood in your stool, that should never be normal. So you should definitely talk to your primary care doctor and probably get referred for colonoscopy. If you have unintentional weight loss, that's something that shouldn't be happening as well. And then people who have anemia, so low blood count for no reason, that kind of ties in with the blood and stool. And then seeing any changes in what we call the caliber of your stool, so thinner stools or suddenly feeling like you're not having bowel movements or having like abdominal pain, things like that could be signs of colon cancer. It could be signs of other things as well, but those are things that you don't want to miss.
Okay. Okay. All right. This is interesting. Because you do like there's so many things that people will attribute to just a bad eating habit, right? Or more
Mhm.
bread intake or heavy alcohol. And then they'll say, I'll just need to take a break from these things. But what I'm hearing you say is that we don't need to just dismiss it. We need to pay attention. And if we see a recurrence of certain things, or even a package of some of those symptoms that you mentioned, it's
Mhm.
indicative that there's time for a deeper evaluation.
Mhm.
Okay.
I agree.
Okay. Well, let me tell you, I'm incredibly scared of having a excuse me, but I understand the need. And I'm like, okay, this is one of those things that it's part of the process. It's necessary for my health screening and my prevention. And so I know that there are thousands upon thousands of listeners who are like me that are just like, oh, colonoscopy. It seems like the most painful or even horrific experience. And there's stories out there, right, of people who've gone through and you hear the stories and people all back away. I want to determine if it's an option because I think some people think it's an option, like it's an option. I hear from you, I'm hearing it's like it's now I want to say mandatory, but it is an essential part of screening. But I think a lot of people view a colonoscopy as an option because if there's nothing wrong, there's nothing to fix.
So that's definitely, I know that's what I went back to the silent killer, how if you don't have any symptoms, you think you're fine. But then because one of the symptoms of colon cancer could be no symptoms, then I definitely wouldn't call it an option. I think what's reasonable if you're what's called average risk, so not having any of those red flag symptoms that I talked about, you could discuss with your primary care provider instead of doing a colonoscopy. Maybe you can try a stool-based test because that is another way of potentially screening, like the FIT test or the Cologuard can definitely discuss that. going back to the fears with colonoscopies, it's a very safe procedure.
Hmm.
There definitely are possible complications, as with any kind of procedure. There's a small complication of bleeding or infections or what's called poking a hole or perforating. Those are definitely some real possible complications, but they're pretty rare. And I think if you go to a center where they do high volumes or a lot of colonoscopies, then the risk of that is lower. Um,
Okay. So I want to go back to the a couple of those screenings you mentioned. Are those home screenings?
so they can be, yeah. So
Okay.
what happens is your primary care doctor can give it to you or they can mail it to you, and you can just get a stool sample and put it on the card, and then you send it back to a lab, and then the lab tests it for different precursors of colon cancer that you can find within the stool.
God bless every doctor that has to receive those lab results.
But luckily, they just say positive or negative. Yeah.
Wow. Yes, that's not mail I'm looking forward to. Okay, so I want to know a little bit about the experience of women, specifically Black and Brown women. Some of the conversations that we need to have with our doctors, or things that we should be saying in our appointments, or that are being missed. Do you have any observations that are specific to us as women and the way we approach our healthcare?
I mean, I think from what I've noticed, women are actually more forthright in approaching their healthcare. More often, it's men who need to be like prodded by like their spouses or their wives. One thing though with women, I feel like sometimes their symptoms aren't taken as seriously, and I know they've done some studies for that. So I'd probably say that if you feel something is wrong with your body, don't be discouraged and make sure you make it obvious to your primary care doctor, whichever physician you're seeing. And if you feel like you're not being seen or taken seriously, the great thing about America and a healthcare system is you can always go for a second opinion. So don't just sit and do nothing. If you feel like something's wrong with your body, advocate for yourself.
Okay, okay. Okay, and then I'm just thinking about this because you just mentioned that men are the ones that kind of need to be poked and prodded a bit more to pay attention to their health care. Um, but I also think that there's a large percentage of my audience who are women without, possibly without health insurance, just because they're entrepreneurs or may have gaps in their insurance.
Mhm.
What happens when you are in that middle space where you don't have health insurance? How do you approach these screenings? Are there centers for free screenings or things like that in the country?
So, so when I mentioned the modifiable risk factors, unfortunately, insurance status is a big reason that people miss being screened because colonoscopies, if you're trying to pay out of pocket, are expensive, unfortunately. Um, and so for people who don't have insurance, I probably recommend looking at your different county departments because there's sometimes ways to go about it. A person who doesn't have insurance and who is average risk, so no family history and none of those red flag symptoms, may be better off getting screened with a stool test because that's a perfectly reasonable screening test and it's cheap. And then if that's positive, and then sometimes the county will cover colonoscopies. I know right now I'm in Birmingham, Alabama, and I know the county does provide a certain number of free colonoscopies for patients who don't have insurance. But then that would be the time where you'd have to work with your provider and probably have to work with a social worker to get the best resources so you can still get screened without obviously having to pay out of pocket because I understand it's an expensive test and we don't want that to be a barrier.
Mm-hmm, mm-hmm. And then in terms of treatment for, women in Black and Brown communities, is the treatment process more aggressive? Have you found that it's different, or that the response is the response to treatment has not been as good as it's been for other people?
So treatment itself, it hasn't really been shown like a big difference. Um, Potentially in like chemotherapy, they may say because of some genetics, going back to the genetics, that certain things may work better with one versus the other. But for just regular surgeries and for colonoscopies, there haven't been any difference between male and females for treatment.
Okay. Oh, that's good to hear.
Mhm.
So our lessons today are to have the screenings. Um, and the home screenings are an effective method of screening before the age of 45, just as a safety precaution, right? And so are we saying that we can order those, or our doctor can prescribe this or recommend this, or how do
So
we?
So the home screening is actually only recommended after the age of 45. We
Okay.
don't recommend the home screening for before the age of 45. The only time where you would recommend screening before the age of 45 is if someone has what's called a family history. So if your first degree relative, so mom, dad, brother, sister, had colon cancer at a young age, less than the age of 60, then we start screening you earlier, usually at age 40 or maybe even younger. If you
Okay.
don't have any of that, then we call it an average risk. And then you can offer the home screening starting at age 45, which is the stool test, the FIT
Mhm.
test or the Cologuard, or you can go straight for the colonoscopy as well.
Okay. Okay. Perfect. Okay. And to be aware and in touch with symptoms is incredibly important. Just when we have these abnormalities, not to just, I think as women, we tend to pressure through. We want to be strong, or not even we want to be strong, but we have
You're
so
taking
many
care of
things
other
on our
people,
plate,
and so you don't think about yourself.
too many things on our plate, and consequently, we end up being last on the plate. But that can create grave circumstances down the road. So it's important for us to really pay attention to symptoms in any form as they approach and have these conversations and then advocate aggressively for testing and screening as needed. Yeah.
Exactly.
Okay. I can say I've been guilty of not advocating, that I've been guilty of taking on a lot and just going, oh, I just need some sleep. Or, I just need to drink more water. Or trying to find the things that I could do better, but not always doing the investigative work that needs to happen. So, great girlfriends, you're hearing it from me first. I take full responsibility. And have the need to be more diligent around those things, but also having this conversation, Dr. Fox, I think it's important for us to, as women, to start talking about it. I know we like to talk about the fun and exciting and the more leisure conversations when we're with our friends, but talking about colorectal cancer, talking about family history, talking about screenings, asking questions is so important because we're so communal in the way that we approach life. And I feel that if we are more vocal in our circles around healthcare and advocating for living our best life and getting that soft life that everyone's after, then some of these things, some of these screenings and preventative methods are the way to ensure we can have that better quality of life. So I think it's important for us to introduce, I mean, I can say for sure that by having these conversations with so many different practitioners, I plug into my friend circles and I'm like, so has anyone even heard of this? I start asking questions, or have you had this screening? Or, did you know? I didn't know that Chadwick Boseman passed from colon cancer. I knew it was a cancer. I didn't know what form. And yeah, and so those kind of things. Just having those conversations, but in a way that it is applicable to our personal life and kind of calls us to action, I think is incredibly useful for us as women. So I'm going to ask great girlfriends that from this conversation, you plug that conversation into your circles wherever you are, your group text, your Facebook groups, your chats, and just ask, hey, has anyone had a screening for colorectal cancer, and have you had a colonoscopy, or can you go with me, because I'm afraid to go to and have this procedure done alone. Similar to how we approach mammograms, I think we've gotten a lot better around advocating in that space, but this is another level of us touching across, all the things that matter to our bodies and our quality of life. Yeah.
Yeah, I mostly like mammograms. That's a good point. So like mammograms because women share that in common for the most part. But in
Yeah,
colonoscopies, you don't really think about it as much. But we should advocate for both of them equally because cancer kills, and we're trying to stop that.
absolutely. And knowing that it affects our communities at a faster rate, really kind
Yeah.
of puts a sense of urgency behind my body, my being, to want to say, hey, ladies, have we had, maybe because we're not talking about it, or, we're not even considering, some of the things that we should be considering on a regular basis. So I want to thank you for that. And just one last thing. What is your goal as a practitioner? How, what are some of the things that you are fighting to, I know this is one area that you're fighting to kind of reduce the numbers, but what are some of your goals as a practitioner? How do you know you're successful at the work you're doing?
So, I mean, so a good way to know is to actually research it. So part of what I'm doing. So I'm a clinician. So that means I see patients in clinic. I do the colonoscopy, but then I also try to investigate it to see how we're doing. So my goal is to be able to investigate and see how many patients where I serve as a clinician are within the age that should be screened, and am I actually screening them appropriately? And then the bigger question is, how can I address the reason that they're not being screened appropriately? And it goes back to the idea of, is it because they're too scared? Are they not educated? Do they not have insurance? And so my goal is to understand the community that I'm working with so I can increase the rates of colon cancer screening.
Okay. Okay. So this awareness, this conversation helps to create the awareness, which is much more helpful and supportive of your goal as well.
Yeah, we're in this
Perfect.
together.
Perfect. I love that. So, where can our great girlfriends keep up with you to learn more about the work that you're doing or to possibly ask questions and just learn from you?
So I do have a Twitter account.
Okay.
So it's my name, Patricia Ajayi-Fox or G.I. Ajayi.
Uh-huh.
And so you can keep up with me there. I don't really have that much social media presence anywhere else.
Okay. Okay, perfect. So Twitter's the place where you hang out.
Yeah.
Awesome, awesome, awesome. Well, I want to thank you, Dr. Patricia Ajayi-Fox, for joining us today. Great girlfriends, thank you so much for taking time out to tune into this conversation and to learn more about the silent killers, specifically to colorectal cancer that are affecting our community. And please take this awareness into your conversations, into your home, into your church groups, into your friend circles, so that we can help to keep each other accountable to our quality of life. I think that's so important. And we do it on so many levels. We're going to add this one to the mix of conversations that we're having. Yes. Thank you so much, Dr. Fox, for being with me today. I appreciate you.
Thank you, Sybil. It's been a pleasure.
All right, great girlfriends. Did you enjoy this week's episode of the podcast? If so, would you please give us your amazing review on iTunes? Every single review helps another great girlfriend get plugged into the podcast and the community. Speaking of community, make sure you join our Facebook group at The Great Girlfriends, follow us on Instagram at The Great Girlfriends, and on Twitter at _great GFS. I'm Sybil Amuti, and I'm out. Peace.